Good afternoon, everyone. My name is Bradley Davis. I'm the co-founder and CEO of Stirdie. It's an absolute privilege to be standing here with you today at the Digital Health Festival. This is a gathering of innovators, leaders, clinicians, technologists, and policymakers, all of us connected by a common belief that healthcare can and must be better. Not just faster, not just smarter, but more human. Today I want to take you on a journey that challenges some of the assumptions that we make every day. A journey that asks, what does it really mean to communicate freely in healthcare? What does it mean to trust, not just our teams and our organizations, but the very systems that carry the messages to us each day? I want you to think about the last message that you sent today. Maybe it was an SMS to a colleague letting them know that you were running late. Maybe it was an email to a patient's care team with a vital update. Maybe it was a quick chat message to your department or manager. Do you have it in mind? Now I want you to ask yourself, were you absolutely certain that your message reached exactly the right person? That no one else saw it on its journey to your intended recipients? That it was not intercepted, copied, altered, or redirected in any way? The truth is, most of the time, we don't really think about this. We trust the technology, we trust the servers, we trust the Wi-Fi connections, the mobile networks. But trust, in many cases, is a fragile thing. It's an assumption, it's a hope. And for many industries, that's tolerable. If a marketing email gets misrouted, if a meeting gets intercepted, the consequences are often minor. Annoying perhaps, embarrassing maybe, but not catastrophic. But healthcare is different. In healthcare, communication isn't just business. It isn't just operational. It isn't just administrative. In healthcare, communication is clinical, it's personal, and it's sacred. A single message, one missed update, one mistyped recipient, one compromised channel can mean the difference between proper treatment and treatment delays, between privacy protected and privacy violated, between dignity preserved and dignity destroyed. In healthcare, trust isn't a luxury, it's a necessity and it's foundational. Without it, without absolute certainty that our messages are reaching the right hands, safely, securely, and verifiably, we risk the privacy, reputation, and dignity of those whose care we have been entrusted. I want to challenge the idea that hope is enough. Hope that our messages are secure. Hope that our systems are reliable. Hope that breaches won't happen to us. Hope is a wonderful thing in life, but it's a terrible strategy in healthcare communication. So let's talk about something that's stronger than hope: confidence. A trust that you can see, prove, and rely on. Trust shouldn't be invisible. Trust shouldn't be something we feel in our gut and hope for the best. Trust should be built into the very fabric of the communication systems, visible, verifiable, and immutable. And if we can do that, if we can rebuild healthcare communication on a foundation of provable trust, we won't just protect data, we'll protect relationships, we'll protect organizations, and we'll protect lives. We live in an age of incredible progress. In just the past decade, we've witnessed breathtaking transformations in healthcare. Electronic health records available at the tap of a screen. Remote patient monitoring systems bringing care into rural homes. Telemedicine, connecting specialists and patients across continents. AI-assisted diagnostics that can catch illnesses faster than human eyes alone. We have more technology at our fingertips today than any point in human history. We can heal faster, diagnose easier, coordinate care more precisely than ever before. And yet, despite all of these advancements, the fundamental way we communicate in healthcare remains frightfully vulnerable. The systems carrying our most sensitive, urgent, and most sacred messages are often the least evolved part of our technological ecosystem. We are still, in 2025, relying on methods that were never designed for the stakes that we now face. Think about it. Email, built for convenience, not for confidentiality. Fax, a relic of the 20th century that we've duct taped into the digital world. SMS text messaging, fast, yes, but frighteningly exposed. Consumer-grade messaging apps, built for social chatter, not for clinical care. These tools were designed for speed, not certainty, for connection and not compliance. And every time we use them, every time we move a patient's information across these channels, we're betting against the odds. We're trusting systems built for a different time, a different risk landscape, and a different world. And the cracks in that trust are no longer theoretical. Let's look at the breaches that we've seen across Australia just in the past 12 months alone. First, there was Medisecure, a name trusted by millions for secure prescription services. A single breach compromised the privacy of nearly 13 million Australians. 13 million. Health data, prescription records, personal details, all swept out into the open where it can be stolen, misused, sold, and manipulated. Think about what that means for a patient. It's not just the inconvenience of a changed password. It's the fear of exposure, the loss of dignity, and the feeling of betrayal. Knowing that private struggles, private diagnoses, private treatments might now be public knowledge. And then there was Genia IVF clinics, another name trusted by families at one of the most tender and vulnerable points in their lives. An attack that didn't just steal their data, it weaponized it. The dreams, the heartbreaks, the personal journeys of families seeking to create life, posted, sold, and exposed. How do you put a value on that kind of a breach? You can't. Because the damage isn't just financial. It's emotional, psychological, it's human. And just months ago, the Women's and Children's Hospital in Adelaide faced its own breach. Not because of negligence, not because of a direct attack on the hospital itself, but because a third-party contractor's systems were compromised, systems trusted to handle patient data securely. Thousands of patients' records, names, health information, personal histories swept into the hands of bad actors. Another breach, another wound to public trust, and another reminder that the chain is only as strong as the weakest link. Now, these incidents, they're not just bad luck. They're symptoms of a system that's straining and failing to handle the complexity, sensitivity, and stakes of modern healthcare communication. And the silent tragedy is this. Every day that we continue to rely on these fragile systems, every day that we cross our fingers and hit send, every day that we hope instead of knowing, we're rolling the dice with something precious. With privacy, with patient privacy, with organizational integrity, and with professional reputations. The thing is that hope is not a strategy. Good intentions aren't enough. Well-meaning policies are not enough. Because even the best doctors, the best nurses, the best administrators in the world can't protect the systems that aren't designed to safeguard. This is about trust. It's about relationships. It's about the invisible bond between patient and clinician, between a healthcare system and the community it serves. Every time a message leaves your organization carrying sensitive patient information, you are making a silent promise. I will protect this. I will respect this. I will honor this. And when our systems let us down, when a breach happens, we break that promise. So, if the systems that we rely on today aren't enough, if hope is no longer acceptable, what is the alternative? What would it look like if we stopped patching old broken systems and started building something entirely new, something designed not just for convenience, but for certainty? Something that doesn't just assume trust, but proves it. At Stirdie, that's exactly what we've set out to do. We've asked ourselves a simple question. What would healthcare communication look like if it was built for trust from the very first line of code? And the answer, Stirdie, is a complete reimagining of how we communicate. A system where trust isn't invisible, trust isn't optional, trust is woven into every message, every interaction, and every connection. Stirdie stands on three pillars, three simple but transformational ideas, each one on its own powerful. Together they form a communication system that's fundamentally and irreversibly different. Before a message is sent, before a single character is typed, every participant in the Stirdie network must be verified. Not self-certified, not username and password protected, but verified through rigorous, secure, auditable processes. Because if you don't know who you're talking to, nothing else really matters. Identity is the foundation of trust. You have confidence that you're communicating with the person that you think you are and no one else. These verified organizational and individual identities form a trusted directory of verified users. Security shouldn't be a setting. It shouldn't be an option that you have to remember to toggle on. It shouldn't be something you add after the fact. Security should be the default, and at Stirdie it is. Every single message sent across the network is encrypted, automatically, end to end, from the moment it leaves your device to the moment that it arrives at its verified destination. No weak links, no vulnerable handoffs, no moments where messages can be intercepted, copied, or corrupted. It's like sending a message inside a locked armored vehicle through a private guarded tunnel directly to the person that you intended and no one else. And you don't have to think about it. It just happens. Every single message, every single time, by design. Now, encryption protects your message in the moment. But how do you prove after the fact that the message's integrity was maintained? That's where blockchain comes in. Not as a buzzword, not as a gimmick, but as a powerful tool for transparent verification. Every interaction on the Stirdie network, every message that's sent, every identity verified, every access approved is recorded immutably on a private blockchain ledger. Not the contents of the message, but the facts that they moved securely, verifiably between verified parties. This creates an auditable trail of trust. Who sent the message, who received it, when it happened, that the encryption was maintained end to end. And because blockchain is tamper-proof, no one can alter the record after the fact, not even us. It's proof that communication happened exactly the way it should have, without asking you to take anyone's word for it. Because in the new world of healthcare communication, trust must be verifiable. Let me translate all of this into plain, practical language. You always know exactly who you're communicating with. Your messages are always protected from prying eyes. You can always prove to a regulator, a court, a patient, or yourself that you upheld your duty of care. No more gray areas, no more crossed fingers, no more hoping that the system worked. Just communication that you can trust, communication that you can rely on, communication you can feel proud of. So let me bring this to life, not through a technical diagram or through a pretty chart or bullet points, but through a story. Emily is a senior clinician at a large hospital. One afternoon, Emily is reviewing a new patient file, a young man recently diagnosed with a complex autoimmune condition. He's anxious, his symptoms are escalating rapidly, and time matters. Emily knows that the best course of action is to refer him to a leading immunology specialist, someone that she trusts, who happens to be and work at a private practice across town, outside of her hospital's IT network. Now, Emily has to share critical, detailed, sensitive information, blood test results, imaging findings, preliminary diagnosis notes, treatment considerations, information that will determine how quickly patients get specialized care. Maybe the easiest way for Emily to send that is by email. Maybe, hopefully it's encrypted, maybe not. Maybe the specialist receives it immediately, maybe not. Maybe it gets stuck in a spam filter. Maybe someone else, someone unauthorized, intercepts it along the way. Emily's done everything right clinically. She's acting in the patient's best interest, but the system that she uses to communicate, it forces her to hope. To hope that the message gets through safely, to hope privacy is preserved, and to hope there is no breach. And every time she sends a referral this way, there's a tiny knot in her stomach, a worry, a hesitation, because she knows if something goes wrong, if a breach happens, it won't really matter what her intentions were. It will matter that trust was broken. Now I'd like you to imagine Emily working within the Stirdie network. She opens her secure app or works through her integration in the software that she uses. She finds the immunologist already verified, already authenticated, identity confirmed beyond doubt. She composes her referral message, attaches the necessary medical records. From the moment she hits send, the message is fully encrypted, locked down, private, and protected. It moves through a closed, secure network where the immunologist receives it. Stirdie automatically records the transaction on a private blockchain ledger. No patient details exposed, no sensitive content made public, just a secure, immutable record that proves the communication happened the right way, the safe way, the compliant way. No uncertainty, no sleepless nights, just trust built into the system. Emily doesn't have to hope anymore, she knows. Now multiply Emily's experience across thousands of clinicians, doctors referring patients across different health networks, specialists consulting with general practitioners in rural areas, hospital technicians sharing imaging results with off-site specialists, allied health professionals coordinating multidisciplinary care. In each case, the old system demands hope. The new system, Stirdie, provides certainty. And when certainty replaces hope, trust flourishes, communication accelerates, and care improves. We free healthcare workers from fear so they can serve with freedom. Freedom to collaborate, freedom to innovate, and freedom to care without hesitation. Built not on faith alone, but on proof. For decades, organizations have built walls to protect themselves, walls designed to keep bad actors out. But walls only work when everyone is inside the same system. And in today's interconnected world where specialists collaborate across practices, where community organizations partner with healthcare networks, where global research teams share sensitive data, walls aren't enough. We need bridges. Bridges built on verified identities, bridges protected by encryption, bridges strengthened by blockchain-proofed audit trails. Stirdie isn't about building bigger walls, it's about building stronger bridges. Bridges that you can cross without fear, bridges where trust travels with you. Bridges that connect people, organizations, industries securely, seamlessly, and confidently. The world is already shifting. In the next decade, the organizations that thrive will be the ones that can say to their patients, their clients, and their citizens, you can trust us. Not because we say so, but because we can show you. And the ones who can't, they'll be left behind. The principles we're building into Stirdie, verified identity, end-to-end encryption, immutable audit trails, are the blueprint for the future of communication across every sector. Stirdie will stretch outward, linking schools, businesses, governments, families, creating a world where communication flows freely, fearlessly, and faithfully. A world where trust isn't the exception, it's the expectation. That's the world we're building. And the future belongs to those who start building it now. At Stirdie, we're not just imagining this future. We're not just drawing pretty diagrams. We're not publishing white papers and waiting for someone else to fix the problem. We're building it line by line, connection by connection, chain by chain. We're building the future of communication. Today, I want to extend an invitation to be a part of a network where trust isn't just assumed, it's verified. An invitation to help build bridges where before there were only walls. Today, we're opening a limited number of spots in our beta program for organizations and individuals who want to be a part of the foundation of Stirdie. What does that mean? It means early access to Stirdie's secure messaging platform, direct influence over the development and evolution of the system, partnership with our technical and leadership teams to shape the features that matter most to you. You'll have the chance to test the system in real-world conditions to see how seamless, secure, and verified communication can transform the way you work. You can help refine it, strengthen it, and prepare it to serve not just your organization, but the entire healthcare sector and beyond. If you're someone who looks for a way to communicate today and thinks there has to be a better way, if you're someone who understands that protecting patient data isn't just a legal obligation, but a sacred trust, if you're someone who believes that innovation and responsibility aren't opposites, they're partners, then you belong with us. This beta program is not for everyone. It's for pioneers, it's for leaders, it's for those willing to light the path forward, not just for their organizations, but for the entire healthcare community. It's simple. After this session, I'll be here available to speak with you. Please come find me, or you can come to our booth, 521. We'd be happy to chat with you. We'll walk you through what it looks like to join. We'll answer your questions. We'll show you how Stirdie can help move from concept to reality. There's no heavy sales pitch, no pressure, just an open invitation to step into the future where communication is something you can trust again. I'll leave you with this. Hope inspires, hope sustains. But when it comes to healthcare communication, hope is not a plan. We need confidence. We need proof. We need trust that doesn't live in our hearts alone, but in our systems, our structures, and our technology. With Stirdie, we can begin to communicate freely again. Thank you.